I am a semi-retired psychologist and have worked in various areas professionally over the years. Community mental health centers, state hospitals, university setting, prison setting as well. And I've maintained a small private practice throughout most of my time as a psychologist. I've been active in OPA for, again, a number of years, and have served as president. I guess one distinction is I was the first African American president of OPA.
The leadership of OPA has been tremendous in terms of looking at things like APA presidents, number of APA presidents, number of APA board members, committee chairs at a national level, national figures. Our governor is an OPA member, for God's sake. Several congressional representatives have been, both state and national, have been psychologists from Ohio. So I feel like we've grown this group of people who have had tremendous impact on the world.
The first Carl Heiser got the first certification law for any psychology passed in Connecticut. He came from Ohio. Carl Rogers passed through Ohio. He started in Pennsylvania. He was on the Ohio state faculty when he was writing some of his key client-centered concepts. I went to Chicago. George Albee was one of the very first presidents of APA that had any real clinical background in leading. Jack Wiggins was another one of the early, fairly early line of things.
One of the things that I'd like to say that I was privileged to know about Ohio and about what happened in psychology here was that we were the first state to hire an executive director, Henry Saman, first full-time executive director, and he was a marvelous influence in pushing psychology ahead in Ohio through his years here. He continued into the 90s, and he was a marvelous force. So much so that Ohio is recognized as probably one of the 2 or 3 leading states in terms of pushing the psychology frontiers ahead during that period. And I was very privileged to be a part of that.
We've completed many of the tasks of childhood, and Erickson, of course, put the question of identity in adolescence, but I think this day it still goes on into young adulthood.
Absolutely.
So we're still, I think, asking, who am I? Who are we? So we haven't fully moved into adulthood. We seem to go home to the parents probably more often than maybe healthy, and depend on other people to take care of us, so that in clinical psychology and health psychology, which also, by the way, had significant roots in Ohio, is very involved in developing the division of health psychology, as well as involved with clinical psychology at the time. But in those areas, we turned to medicine as maternal figures, and I think it helps keep us less mature than we might otherwise be.
I testified in the House of Representatives against a bill that would have significantly impacted gay rights in Ohio, and has still become one of the most significant acts of my career in terms of things I've done that felt like I had the potential to do something meaningful, and that was testifying at this hearing.
What message would you like to communicate to the students and young professionals in psychology?
It's so important, if you are going to be a productive practitioner, to be aggressive, working with your state and your colleagues in challenging the restrictions of managed health care.
I would like them to remember that psychology, like every discipline, is in a constant state of evolution. And I would want them to invest in their professional identity without getting over-invested in a static, rigid definition of what a psychologist is. Things are so exciting right now with prescriptive authority and the integration of biopsychosocial care and the use of psychology to inform public policy around how people make decisions. We can't get locked into a static definition of who we are.
A psychologist is involved in nearly every aspect of life in the 21st century. So budding psychologists, new psychologists to the field have wide open doors. They can work within business, they can work as clinicians, they can work as academicians. The scope of services that we provide and the areas of expertise that we've expanded into continues to grow exponentially.